frontalis, orbicularis, oculi. This would be the zygomaticus major because it's more lateral. And then underneath here would be zygomaticus minor. And then you go everything above the lip in this area, they're known as the levator group. So they elevate the upper lip. Levator, levator, all these are levator labii muscles. This one is the nasalis, goes right across the bridge of the nose. And you go back around the mouth. Now you're still using a circular muscle, so this is orbicularis oris. Everything that's inferior to the lower lip, all I really wanted you to know was that's the depressor group. There's different ones, but all these are depressor labii muscles. Depress the lower lip, lower it in other words.
So if they got different shapes right there, like this one's going...
this one is known as the mentalis. In other words, all these are different ones. Like this is the depressor anguli oris, depressor labii inferioris, mentalis. But as a group, they all cause depression of the lip, and in some cases cause the lower lip to come out.
Okay.
So as a group, just call them the depressor labii group.
Okay.
Then we go over here, and let's do this little muscle that's been cut off. That's the rhizoris. Okay. Goes from the corner of the lip straight back. Now the one that's deep to it and a lot wider, a lot bigger, that's the buccinator. That's the one that compresses the cheeks.
So if you were to put the buccinator number or something on there, would you put
it anywhere along here, anywhere where you won't confuse it with a rhizoris, which is on top of it. Rhizoris is real narrow, real thin muscle. But the buccinator is much deeper embedded in the cheek. It also tends to, since it is so much larger, tends to compress or push in the cheeks themselves. Whereas the rhizoris can only pull the corner of the lip straight back in what's called a sardonic smile, or a smile where just the corners go straight back. These muscles, by the way, when they contract, they cause the smile to go up toward the corners of the eyes. Since they pull down this way, they also accentuate the wrinkles around the eye. These are muscles that when they're under action, the smile is said to reach the eyes. This is more like the used car salesman smile, when the smile goes straight back, but it's not really a true smile. I joke about it, but you know, if anybody's a used car salesman, they know what I'm talking about. And then, just to do the muscles of mastication real quick. Masseter. On this side, temporalis. Where we've cut away the mandible and we have a muscle going up and down, that's the medial pterygoid. And then this deep one, the only muscle of mastication that has fibers that run anterior to posterior, that's the lateral pterygoid. That be them.